Hi, everyone. My name is Reeves Mosley, and I'm the student body president and undergraduate student government president for this year from Dallas, Texas. I'm a senior studying political science with minors in public policy and business. I want to welcome you to today's student webinar to discuss the roadmap for the fall of 2020. I hope this discussion allows us to come together to reimagine the Carolina experience to one that not only helps us prevent the spread of COVID-19, but also making necessary institutional changes that are at the forefront of everyone's minds as we continue to support our Black community in the fight against systemic oppression. We have an incredible group of Carolina's faculty and administrators here to talk with us, and I'll pass it over to my Vice President, Priyanka Rao.
Hi, everyone. My name is Priyanka Rao, and I'm a rising senior from Ridgewood, New Jersey, majoring in biology and public policy, and I'm this year's undergraduate student body vice president. As Reeve said, we are here today to talk about the roadmap for fall 2020, and we have faculty and administrators from across campus to give us details and answer our questions. I'm going to lay out what the rest of this event will look like for you now. So first, we will hear from Chancellor Guskiewicz and the principles this roadmap is based upon. Then, Provost Bluin, who has been charged with leading the roadmap's implementation, will speak. Then we will hear from our panelists. We'll hear from Dr. Mike Cohen, who's the Associate Vice Chancellor of Global Health and Medical Affairs, Dr. Billy Fisher, who is the Associate Professor of Medicine, Division of Pulmonary Diseases and Critical Care Medicine, Dr. Audrey Pettifor, Professor of Epidemiology, Abigail Panter, the Senior Associate Dean for Undergraduate Education, Daryl Jeter, the Director of Emergency Management and Planning, Jonathan Sauls, Interim Vice Chancellor for Student Affairs, and Desiree Reichenberg, Dean of Students. Finally, we will ask questions of our panelists that have been submitted by students.
For colleagues, I do want to recognize that many of our constituents do this work while struggling against many forms of institutionalized racism, which all of us have an obligation to work to eradicate from our campus. I want to thank all the graduate and professional students in attendance here today, as well as the faculty and administrators who are here to talk about the reopening process and to answer our questions. And at this time, I would like to introduce Carolina's 12th Chancellor, Kevin Guskiewicz. Dr. Guskiewicz has been a member of the Carolina faculty for 25 years and was appointed Chancellor last December. Dr. Guskiewicz.
Thank you, Ryan, Reeves, and Pri. It's a pleasure to be with you this evening. I want to welcome everyone for joining us. And we're excited this evening to talk about our roadmap for fall 2020. But before we get started, I also want to say a few words about the events over the past few weeks and the challenges that universities across our nation are facing. Sibby Anderson-Tompkins, Interim Chief Diversity Officer, Provost Bob Bluin, and I have prepared a campus message denouncing systemic racism, hate speech, and white supremacy, which will go out very shortly this afternoon. Systemic racism is a part of institutions across the country, and we've been challenged by this here in Chapel Hill over the years. Staff, faculty, and most of all, students have pushed to make UNC better for decades, and for that, we're grateful. But it's clear that we've moved too slowly. We haven't done enough to the campus community that we aspire to do, and we're going to work hard over these next several weeks and months. We're redoubling our efforts with a greater sense of urgency, purpose, and action. Here's some of what we're doing right now to change. My entire leadership team is participating in the Racial Equity Institute's training this summer, and we're developing a digital training for all staff, faculty, and students university-wide. The Sonia Haynes Stone Center has dedicated space for African-American students and their organizations to hold meetings and events, and you'll be seeing changes there soon. 9 months ago, we hired Chief of Police David Perry because of his commitment to community policing. He's done an outstanding job on our campus. In the months since he's been here, he's made important changes in how we think about campus safety. Last year, we established the Campus Safety Commission, and we are now reviewing and implementing the recommendations from their annual report and had a wonderful meeting with them just this past week. In December, I committed to financially support and back diversity, equity, and inclusion efforts on our campus. And out of that, we announced the formation of the History, Race, and a Way Forward Commission, that's continuing their important work to examine the racism in our past so that we can learn from our past and to move forward in a productive way. But I know this is alone not enough, and we'll have to dig deeper and go beyond commissions, and we will find a way to move forward. Many of you have been fighting this fight for a long time. I am with you, and I hope our actions over these next several weeks and months will show that. We have a lot of work to do. So we're here this evening to talk about the fall 2020 semester. And as I stand here and look out from my office at the South Building at the Old Well, I can tell you that it feels lonely. And we look forward to that day when we can have our students and faculty and staff back here on campus. But we're going to do this only if it's safe to do so, and we're working hard to make that happen. The COVID-19 has certainly changed your student experience this past year, but I want to just take a moment to thank our returning students for your flexibility and hard work last semester. The pivot to online learning was not easy, and you overcame that challenge, and we're proud of you. I enjoyed visiting several Zoom classes and witnessed our faculty hard at work. We have world-class faculty here at Carolina, and they too had to make a pivot at about mid-semester, right around spring break. But they worked hard to allow you to continue learning and growing. And I'm just proud of the way that our university adapted during that very challenging time. Yet, as I've listened to students over these past 8 or 9 weeks, listened to faculty and parents and other members of our community, it's clear that nothing beats the on-campus Carolina experience. We know that students learn in different ways, grow in different ways, and that doesn't just happen in the classroom. Research labs need to continue their important work, and we have a responsibility to serve our state and provide you, our students, with the best possible education, and we're committed to that. And for many students, on-campus education is their only viable option. If it's safe to be on campus, then it's best for us to be on campus. And we'll do everything in our power to make that possible. So over the past 2 months, we've built this roadmap for Carolina's fall 2020 semester. And we're working closely with our infectious disease and public health faculty experts, and you're going to hear from some of them this evening, as well as alongside our incredible faculty and staff and our state and local officials to help get you back to campus safely. You're going to hear from some of those experts today, and I'm going to thank them now for being here, because you've been instrumental in helping us to build out this roadmap, knowing that there may need to be some off-ramps or exit ramps from this roadmap. I just want to touch on the 6 guiding principles that really lead this roadmap. First, our mission has always been that we aspire to be the leading global public research university in the nation. And whether in person or remote, we are focused on accomplishing that mission, and we know that we can do that. I want to, as I've already said, above all else, will be the safety and well-being of our campus community as we move on this journey and roll out the roadmap. And so this is a top priority for us. And as I've said, if it's safe to be here, that's our goal, and we'll do everything to make that happen. We will continue to rely on our world-renowned infectious disease public health experts to help guide our decision-making over the next several weeks as we lead up to the start of the semester. I want to also emphasize, and you're going to hear more about it this evening, but we've had an incredible team working on a plan for how we can provide both in-person, remote, and hybrid instruction so that courses can be taught in a classroom environment with our students while also being taught concurrently in a remote fashion. And we're also working hard to develop our Carolina Away program that will be an entirely remote program and option for students who just can't get back to campus this fall, especially for our international students who we know really want to be here, but we want to try to provide opportunities for them to develop a series of course credit hours before they would enroll when they're able to travel to get here. I've already mentioned that the roadmap will have off-ramps, exit ramps, and this is necessary in our planning so that if for some reason it's determined that safety concerns arise at any point in the semester, or even prior to, leading up to the start of the semester, including a resurgence of the virus, that we would be able to pivot and go to another plan, a different off-ramp. And it's going to be important that we continue to communicate with students, their families, faculty, and staff on a regular basis. And we've enjoyed getting in front of our faculty leaders. We've had a large webinar for over 4,000 faculty and staff a few weeks ago, and been meeting regularly with student leaders and small groups around our campus to gather their feedback, because this is a community effort. This will not be a typical fall semester at Carolina. It'll be unlike any in our 226-year history. It's going to look and feel different, but we believe that we can still provide our students with a safe on-campus experience. And our ramp up for on-campus research operations began last week, and it's going great. I've emphasized to everyone that we really never shut down at Carolina. So this isn't really a reopening because many people have been still working on campus while many others working remotely. And we've continued the great work of our university. So on the guidance of our infectious disease and public health experts, we decided as a team to start the semester early and finish early to try to stay ahead of a potential second wave of the virus should that occur when the weather turns colder in perhaps November, December. And so we'll start on that fall semester on August the 10th. There will be no fall break. And we will end the semester with final examinations going no later than November the 24th, which is the Tuesday before Thanksgiving. But we're asking our campus community to adhere to public health guidelines and to help mitigate the spread of COVID-19. And this is going to include an adoption of community standards that are being developed as we speak. And we're gathering input from those who will be here on campus participating as citizens of our campus. This will involve wearing face masks in public places, practicing physical distancing, and being vigilant with personal hygiene, and much more to come. This is not easy, and there's going to be, there will be challenges and there will be some risk, and we understand that, but we're going to do everything possible to help minimize those risks. But I'm confident in our community's ability to do this together. I've been here for 25 years at Carolina, and I've interfaced with so many faculty, students, and staff during that time that I just believe that we can do this together. I believe that as students, you have an opportunity to lead and create a new standard of community care and leadership. You will carry a large part of this responsibility to keep our campus safe during this coming fall semester, but you are up to this task. I know you are. There is an assumption. You can pick up a newspaper any given day, and there is an assumption by many people across the country that college students won't sacrifice or change behavior for the good of others. I know you will. I know that you will meet this challenge and prove that assumption wrong. I've seen Carolina's compassion on display every day, and we will need this compassion for one another, that we take care of not only ourselves as we adopt these community standards, but we are caring for everyone around us as well. So we have a panel of speakers, and I'm excited for you to hear their wisdom and expertise and the work and passion that they have put toward helping to develop this roadmap. Particularly our infectious disease experts. These are the best researchers in the world on coronavirus here at Carolina, and we're fortunate to have them here. And Provost Bob Lewin, who's the executive director of the roadmap that we're going to be discussing tonight, is leading the implementation. I'm grateful for Provost Lewin's leadership in this regard. So as I said earlier, I look forward to the day soon when we can look out onto McCorkle Place or Polk Place and see a vibrant campus, but one in which is safe for everyone to be here. So I want to thank you, and I look forward to hearing your questions later in the program. I'm going to turn it back to Reeves now.
Thank you, Chancellor Guskiewicz, for your leadership and your team's leadership moving us forward. Now we will hear from Provost Bob Lewin on the implementation of the roadmap and what this means for students.
Thank you very much, Reeves. And I want to thank all of you for taking the time to join us today and being a part of this conversation. My job in my few minutes is to give you just a glimpse of the Carolina Together roadmap and to give you a sense of where we are and where we're headed with it. As you hopefully have already had a chance to review, the Carolina Together roadmap is placed on the front page of our website, and you just need to go to Carolina Together, click that, and then you can begin to appreciate the plan that the university has laid out for this community. It's important to emphasize that the roadmap itself is a rolling, evolving document, one that will be informed by new information, new knowledge, particularly informed by our experts on campus, our healthcare experts from our School of Medicine, in particular our infectious disease faculty, as well as our UNC healthcare system and our public health community, including the Orange County Public Health Department. And so we want to make sure that all of you realize that the document that you read in Carolina Together is going to change. It's going to evolve, and you're going to help us make it better as you raise questions, as new information becomes made available to you, that you will have an opportunity to make suggestions, recommendations, and we will be reaching out to you over the next several weeks to get your input and your ideas, because the only way we're going to be successful is by doing this together. As Chancellor Guskiewicz mentioned, this is something that we believe we can do safely. Renew the mission of this university, a mission that is one that we all embrace. It's why we are here. It's why you are here. And it includes not only our educational mission, but also our research, our service, our care to patients, our global ambitions. And we believe that we can come back to campus together and pursue the mission together. But we can only do it safely if we all understand how to work together to make this a safe environment, and we all must play a role in that implementation. And so what I'm responsible for right now is to put an implementation execution plan together with a relatively small group. We're sort of treating this as a SWAT team type of an effort. And we're trying to make sure that Carolina Together roadmap maintains a contemporary view of what needs to be done based on all of the new information that is going to be coming forward. So you might read it and say, well, this is incomplete, or this section needs more clarity. And that may be true. And so our committee is going to be updating all aspects of the roadmap over the next several months. And even after the roadmap actually is launched, after everyone comes back to campus, because we're going to continue to learn throughout this process. And our commitment is to make sure that this is the absolute safest place possible as a result of implementing contemporary best practices towards everything that we do. As Chancellor Guskiewicz mentioned, many of our colleagues, not only our faculty, but students and staff have already come back to campus in the form of the research effort. And they are going to be doing a research project of their own in understanding all the aspects of what it means to come back to campus. And so we're going to learn a lot over the next month to 2 months. And that learning is going to further inform us on a wide array of things, like testing and tracing, as well as how we might want to proceed in the future. So I just want to thank you all for all the work that you've done so far. I want to thank you in particular for your interest. I hope that you will continue to remain very interested in all that we are doing. I hope that when asked, you will contribute and volunteer your time, your effort, your ideas to helping to make the Carolina Together Roadmap the very best plan that we can possibly put together on behalf of the interests of this community, so that we can all together pursue the mission of UNC Chapel Hill. And with that, I will turn it back over to Pri. And Pri, thank you very much for all that you're doing.
Thank you, Provost Bowen, for all that you're doing as well. Now we're going to hear from Dr. Cohen, Dr. Fisher, and Dr. Pettifor. All three are experts on infectious disease and have been advising the administration on how to keep the campus community safe.
Thanks for the students for being here today. I must say, we're looking forward to the students coming back. This is a lonely place without the students. It's kind of empty. So I think the faculty at our university are looking forward to the return of the students. My job first is to introduce my colleagues. Dr. William Fisher is a pulmonary care and critical care specialist who's interested in emerging infectious diseases and has had a lot of experience now in helping to manage sicker people with COVID and in developing new drugs that we're testing on campus. Dr. Artie Pettifor is the head of our infectious disease epidemiology group. And she's playing a very special role because as we return to campus, Dr. Provost Bowen is the implementation guy, and Dr. Pettifor is leading a monitoring and evaluation team. Like, how well are we doing in all our expectations of the return of students and faculty to the campus? So I'm just going to say a few words and then let them add. SARS-CoV-2, that's the virus. It's a coronavirus. It's new to our species. Our species did not see this virus until December. But now, just a few months later, we have seen massive numbers of people who've acquired this virus, who develop an infection called COVID-19. Now, most people with COVID-19 do perfectly well. So that's an important thing to emphasize. It is a self-limited disease for most people, especially younger people who don't have any underlying illnesses. About a third of all the people who develop COVID-19 are asymptomatic. They never develop symptoms. But older people, or people with what we call comorbidities, like obesity and hypertension and diabetes and all the illnesses that people my age suffer, in all candor, we, for whatever reason, are more vulnerable to the consequences of acquiring this infection. So it's new to our species, and the most important thing we've done in the last, since you've all left, and why we delayed the return, is to learn the rules that govern the virus and how to create a safe environment around this virus. And it turns out to be really, really simple. The first issue is that face masks really work. Just about any face mask makes a huge difference. First of all, it helps you not to acquire something that's that would be in the air near you. Most important, if you're coughing or sneezing, that cough and sneeze can't go anywhere. So it's an altruistic, patriotic thing that you're wearing a mask because you're not spreading the virus that might be in your nose or your upper respiratory secretions. The second thing we know is that distance makes a difference. Just a few feet. This virus doesn't travel very far from an unbridled cough or sneeze. So distance makes a difference. The third thing we know is that simple hand washing kills the virus. So masks that are ubiquitous and worn regularly, some distance among people, and included in that is avoiding congregation of large groups, and hand washing are incredibly simple and incredibly effective. In a very dense place like Hong Kong, which has 10 times the density of New York City, these simple maneuvers have led to no epidemic and less than 100 deaths in the entire country. So it kind of breaks my heart in all candor to see that in the United States, we can't get our message straight. That for whatever reason, there's so many mixed messages being delivered. It's crazy. So we're trying now, our faculty are trying to deliver to students who we think are really smart an unambiguous, non-mixed message. If we do these simple things, this semester will go well. Masks, which we're going to make readily available, and I believe they'll be beautiful and branded as I understand it. Probably people will want to buy them all over the world. So masks work. Don't congregate, small groups, and wear masks when you're together. Keep distance apart whenever possible. Just 3 or 4 feet makes a really big difference. And wash your hands. It's just not that hard, but it's been hard across the country. And we're asking you to do that for 1 semester to help us bring you back to campus, and especially to keep the faculty safe, because the faculty are in general much more vulnerable than the students. And so if the students have that sense of responsibility towards the campus, this will be a big success. Now, the last thing is really important before I turn it over to Dr. Fisher. If you don't feel well, don't go to class. If you don't feel well, don't go to class. You may or may not have COVID, but there's no reason to go to class. Instead, you'll go to the Student Health Center, where we've set up a very easy way to test whether you're infected with COVID. We have a very easy way to manage students who would acquire COVID if a small number do so. So it's not a stigmatizing, terrible, life-threatening event. It's really, really going to be simple and easy for us to manage, as long as students don't feel they need to go to class sick or hide that they don't feel well. So Dr. Fisher has been working, as I said, assiduously on the kind of sicker patients, very few of whom are young. I'm going to turn it over to him to see what he'd like to add. Dr. Fisher always wears a scrub suit for effect. He doesn't really need it. He's not a surgeon. He really doesn't need the scrub suit, but it's very dramatic. So, especially for pre-meds.
So first, thanks Reeves and Priyanka for the opportunity to be here tonight, and as always, Mike, for the introduction. What Mike didn't tell you is that I actually grew up in Chapel Hill, literally right down the street, so that I ride my bike here. And so I very much, I did all my training actually at a place in Baltimore called Johns Hopkins, and came back to UNC because this has always felt like home to me. And I know that many of you all feel that this campus and this university is a home to you all as well. And I can tell you that we've all been working really hard to make sure that your return home is safe, and that you have all the resources at your disposal. And so we are very much looking forward to you all coming home. I think what Mike said is really, really important, and that the rules of infectious diseases are critical here, and that there are steps that we can take to prevent the transmission of this infection. We know that it's spread through respiratory droplets, and that's why distance matters. We know that if you touch an infected surface and touch your eyes, nose, or mouth, that you can potentially transmit that disease to you. And that's why the hand hygiene is so important. And the masks are really important by limiting the spread of those respiratory droplets to other people. So this is a community responsibility to keep our homes safe. And so I think there are some simple steps that we can do to keep ourselves safe. The other thing is that we've also been working really hard to make sure that if people do get sick, that we can take care of them in a state-of-the-art facility that has the best available treatments. And we have done that at UNC. We have literally transformed our hospital over a period of weeks to create a state-of-the-art facility where people can get the very best supportive care and potential therapeutics that offer a chance to fight back against the virus. One of the drugs that you have probably heard about is called remdesivir. And that drug was actually, all of the science behind that drug was actually done on campus in a lab run by Ralph Barrick in partnership with Tim Sheehan. And so a lot of the science that's driving forward the treatment of this disease is happening right here. They've also worked on a second compound called NHC, and we are about to start treatment with that. We're about to start trials of that drug on campus in the next day or so. And so UNC is really leading the fight against this disease, both on campus and internationally. And so we've worked hard to create that safe space where people can receive care if they need it. And so I think when I think about what does this mean for me and what does this mean for our community, it means that we have all of the resources here to keep people safe. It means that we have all the resources to take care of patients if they become infected. And so we have worked hard to make sure that this is a safe home for everyone. And I'll turn this over to Audrey.
Thank you, Billy. Audrey.
Great. Hi, thanks, Billy. Thanks, Mike, and thanks for the opportunity to talk to everybody. So I am an epidemiologist, and before COVID, my life was centered on HIV prevention. So it's really as many other infectious disease folks at UNC. And so it is interesting to see some of the parallels. I'll keep this short just to say our team, and there's a big team of us that have gotten together really quickly to think about research questions and how they can help inform prevention and care on campus have been working hard. We just submitted a research study to the Institutional Review Board, the ethics committee here at UNC on Monday. And that study is really about trying to understand whether the prevention measures that are on campus now are helping keep the research community safe who are back on campus and are coming back to campus before classes start. So that study will be open to anyone supporting and involved in research, including students and postdocs who are involved in research. And so you probably will start seeing recruitment for that study pretty soon. And there we want to just understand, among asymptomatic individuals, what's the prevalence of infection? How many people have it? And what kind of factors are associated with infection? And so we are going to be testing a lot of people pretty regularly in that study and asking a lot of questions about access to prevention on campus. So masks, hand washing, the things that Dr. Cohen talked about. And also looking at how those things relate to infection over time. And we are really hopeful that this study will help us learn about how to better inform prevention as you guys come back, as students come back. We really are learning how to scale research testing and working closely with student health, occupational health, as to when we find people who are positive, how to get them into confirmatory testing and to help with contact tracing. And so I'll stop there and happy to answer any questions. And also just thanks to those students who we also sent out a questionnaire to you guys. And I appreciate we've gotten 4,000 responses already as of this morning. We sent it out Monday, just asking about some of your concerns and experiences and how you're dealing with COVID right now, which I think is also going to be really helpful and informative in thinking about some of the research and prevention efforts when you come back.
Audrey, let me add 3 things that are worth saying. In terms of television, which is the source of information for most of you, let me say it this way: there's no test you've seen that we don't know how to do, that we can't do in large number if we wanted to do it. There's no drug that's being described on television that we're not already testing in one way or the other. And the vaccines you hear about, UNC will start participating in the first vaccine program July 9th. Probably a small number of students might be involved. It's mostly for older adults with more morbidity. But I want to emphasize that the campus is a place that is not just concerned about the safety of the students, but in putting an end to this epidemic as quickly as we can. And so I think it's worth that students understand that the commitment we have towards health in general. I think we're supposed to answer questions now or just keep moving on. Who's in charge? Our lawyer.
Oh, not quite. I still got another year to go. Well, thank you, Dr. Cohen. At this time, we are going to hear from Abigail Panter, who is the Senior Associate Dean for Undergraduate Education, and she will be talking about what the classroom experience will be like for students this fall.
Greetings, everyone. I am pleased to speak with you today about how we're preparing to welcome you back to campus and to class in early August, and how we're reimagining your academic experiences with different forms of in-person and remote instruction. And when we think about our planning for teaching and instruction, we're thinking about all of you, all students, and your varying needs and roles at Carolina. And that includes graduate students and professional school students, undergraduate students, students who will live on campus and near campus as they always have, and also students who are unable to come to campus for various valid reasons. And as students, it's important to you that you have an academic community that gives you access to meaningful, high impact academic experiences and very strong connections that grow with time and experience in your academic areas of study. And together we're trying to cultivate opportunities so that you can make steady progress in your academic work and your research, in your creative performances, and make progress in your degree programs so that you can be achieving your higher education aspirations as we intend and as you intend. So let me just turn for a moment to talk about the different instructional models that will be in place in fall 2020. We studied national models and have 4 of them. The first 3 of them involve face-to-face learning and in-person learning, and the 4th is a remote option. Let me speak about them in one by one. The first one is called face-to-face hybrid or mask to mask, because we will be wearing masks in classrooms. And this one is designed for on-campus, in-person learners and students. And your professor may choose to meet every session in person, just like has been done traditionally. For example, a Tuesday, Thursday class every week, every session for 14 weeks. Or your professor also might choose to have certain in-person meetings and supplement those with some remote instructional activities. That's the hybrid piece of it. So these courses are likely to have remote components along with scheduled face-to-face sessions, and they're synchronous and often involve active learning. The second model is called a high flex model. And this is a course that's designed for both in-person and remote learners simultaneously. So your professor will be teaching two different audiences at the same time. It's not the most simple to do, and it involves technology in the classroom, but it allows for in-person learners and remote learners to be studying and learning together. The third option takes advantage of a model and a structure that many of you know well, which is the lecture and recitation structure. And this one will have a remote lecture, and then our recitations will be small, required face-to-face, in-person hybrid courses. And there will also be chances for remote recitations as well. And then finally, the last option is a remote-only option, which will be one that the faculty member may decide to conduct that synchronously, where you log in at a particular time, asynchronously, where it's self-paced in some way, or some kind of combination of the two areas. Our faculty right now are working hard to look at their courses and invest in their design of their courses with the help of the university resources that have instructional designers and teams of people who are here who are helping them work on this, and they're working hard in this way. So let me pause here and we can discuss more later.
Thank you for that, Dean Panther. Now we'll hear from Daryl Jeter, Director of Emergency Management and Planning, on the ways we can make campus safe for students and all the importance of masks, washing your hands, and disinfecting spaces in this effort.
Good evening. Thank you for this opportunity. And we appreciate this opportunity to share what we have been addressing as it relates to our preparations around community standards. In an effort to ensure that we have community standards for health and safety, we've been giving a lot of our attention to mitigation strategies to minimize and reduce the spread of the virus through measures of addressing community protective equipment and enhanced cleaning. So I'll speak very briefly about our efforts as it relates to those two topics. As it relates to the framework development, it certainly has been a team effort across campus with student affairs, EHS, campus police, ethics and policy, facilities, procurement services, and others. We've addressed in the framework mask on campus. As you heard, the roadmap has indicated that wearing face masks will be the expectation in the fall when you return, and ensuring that there is awareness on the proper wearing of the mask. We're looking into masks that will cover the mouth and nose so that we can make sure that, again, we have those resources available to you should you need them. And wearing face masks is important, as it is about protecting each other and preventing transmission, as was mentioned earlier. So given the expectation and the requirement for masks in certain spaces on campus, the university will provide masks to those students who do not have their own and would need them. And in that, in line with that, the framework allows for us to ensure that we have a plan to have adequate supply of masks and other community protective equipment in the fall. Hand hygiene is critical. And so as it relates to supplies for hand sanitizer and others, we are also increasing supply locations across campus to ensure all of our buildings have adequate supply, and multiple locations by which if you need hand sanitizer through dispensers or other, we have those available throughout our campus in the various buildings. Lastly, as it relates to enhanced cleaning and disinfecting spaces, we do have a plan where we are increasing the cleaning in those high touch, high traffic areas in campus, across campus, including classrooms, dining halls, residential spaces, student support service spaces, and other locations where individuals work, learn, and enjoy the campus experience. To ensure that we're able to promote awareness, you will also see throughout campus signage posted throughout buildings, promoting and encouraging and also reminding to practice physical distancing, to ensure that we're exercising hand hygiene, to also give a sense of direction so that that will help encourage physical distancing as we navigate throughout the building, and also measures to take should you experience certain symptoms. Finally, I will say that our framework is based on standards, best practices, and public health guidance. And ultimately, our goal is to implement community standards that are community supported and are modeled by our students, faculty, and staff behavior. With that, I'll turn it back over to Pri and Reeves.
Thank you so much for that, Daryl. We're going to finally hear from Jonathan Sauls, Interim Vice Chancellor for Student Affairs, as well as Desiree Reichenberg, Dean of Students, who will be talking about student life and how campus will look and feel differently.
Thank you, Pri. I appreciate that introduction. It's good to be with all of you tonight. Let me just start by saying that I recognize that we're wearing out words like unprecedented and new normal. And for many of you, this has been a difficult time as you've been separated from campus, as you've adjusted, as the Chancellor referenced, to pivoting even during the middle of the spring semester. I've talked with many of you over these last several weeks, and I'm just enormously proud and inspired to see how you've adapted and your perseverance. But I know that that hasn't come easy. And so I just want to acknowledge that I know so many of you are eager to get back, even as you still have questions. And so I'll keep my remarks short because I know you want to get to those questions that you want to pose. You already heard a lot about some of the expectations and standards that are going to be in place. And I hope you're paying careful attention to that. It's going to be essential that we all engage in things that are different than we are accustomed to, that may even make us uncomfortable from time to time, because it's going to be essential that we care for one another. Students often lead the way in helping us to think about caring for one another in deep and committed ways. Beyond the classroom, which you heard a little bit from Dean Panter, there will be differences that you will experience in some of the other student-centric spaces that you typically frequent on campus. Our residence halls, while we are looking forward to welcoming students back and being able to offer that as an opportunity, we'll have some modifications and be different. We will have mask requirements in common spaces. We will have additional requirements for residents to ensure that we are promoting the safest possible living environment. Our dining halls will have to adapt. We will have different practices. So long gone will be sort of the self-service stations that some folks may have been accustomed to. There'll be greater emphasis on takeout opportunities. We're exploring other opportunities to expand the dining footprint so that we can observe social distancing. That may include everything from food trucks to tents to other things, but we'll all have to adapt a little bit in terms of how we utilize some of those spaces. I know so many of you during the course of the day occupy spaces like the pit or the library or the union or so many others that are important to the student experience. Those will change and evolve as well. We're working on many facility-centric plans to ensure that we can observe good social distancing, and some of those same ubiquitous mask wearing requirements are going to be in place in those common spaces as well. This is possible. I believe we can do this in a safe manner, but it is going to be on all of us. And the final thing I would say before I yield balance to Dean Reichenberg is we also need to all remember that as a campus, we do not exist in a bubble. We are a part of a larger Chapel Hill and Orange County community. And if we have a responsibility, even when we are not on campus, to make sure that we're exercising good public health practices so we can be good neighbors, as we often talk about. And so I hope that you'll spend some time with the plan, that you'll really spend some reflective time on how you might be able to think about how you'll modify your behaviors so that we can all have a successful semester. But I know we look forward to having you back, and we look forward to answering your questions. I'll turn it over to Dean Reichenberg.
Thank you for that. I'll speak briefly and share with you part of my role in my everyday job and also in planning for the fall of 2020 has really been around the student experience and thinking about what services, support, and engagement looks like as you all head into fall, and as we look to be able to determine the best ways to serve and support and enhance your experience. And so the areas that we have been really focusing on is outside of the health and safety pieces is on this notion of how do you build community when we recognize folks are going to be living and learning in a variety of different places across the country and across the world. And at the end of the day, we're all Tar Heels. We came here to be able to be a part of a family and to be able to be a part of a community that cares. I think now more than ever, it's so important that we can demonstrate our compassion and pride and loyalty. And I think that it's really important that we do that within the context and within the intersections of what we see today is going on as unprecedented violence and racism and oppression against our Black and African American communities, and seeing how that has impacted at a disproportionate level those same communities related to COVID-19. And so when we think about our students and how we want to be able to care and to be able to support your ongoing learning, but ongoing holistic experience, we're thinking about making sure that the delivery of support services and advising will continue to demonstrate that we've got flexibility to be able to offer in the same ways that our classroom environments are offering, both remote as well as hybrid type experiences, but then also be able to accommodate those in-person opportunities whenever we need to in an appropriate public health supported manner. We're looking at opportunities to be able to think about flexibility in the classroom. I've talked to so many of you that have talked about how this is a major concern. We've heard Dr. Cohen say that that's, we want you to stay home if you're exhibiting signs and symptoms and go to campus health. So we need to be able to think about how we're serving and supporting you. Counseling, psychological services, and the toll that all of this is taking on our mental health. Being able to make sure that those services will be able to be provided in a variety of different ways for our students who are studying all over the place to be able to access those. In the spring, we launched the CV19 Student Care Hub, and that will still serve as a support resource. This summer, we are working to be able to retool that resource to be able to make sure it will be ready to be maximized for you to fullest potential in the fall semester to serve as a one-stop shop for you. And the last thing I will say is that many of you come here because we have an outstanding educational and academic and research agenda and engagement, but many of you also stay here because we offer a student life and engagement opportunity like no other. And so I want to be able to recognize that folks across the campus and many of the student affairs and student support areas are really putting together a number of resources for our students and student organizations to be able to help them connect and to thrive in those remote, hybrid, and in-person opportunities. We recognize that some of your key experiences like Fall Fest and Convocation that kick everything off are going to look a lot different as well. But at the core of everything, we want you to be able to experience Carolina and those traditions that make this the place that it is. And so be on the lookout for more exciting opportunities, but also be on the lookout for opportunities to help inform what we are doing to continue to engage you, and for you too to be a part of that engagement with your peers. So thank you very much for your time. Reeves, Ryan, Pri, back to you.
Thank you, Dean Rickenberg. At this time, before we start and move into the Q&A portion of the webinar, we do have a number of other panelists on this call who are going to be available to help answer those questions, and I just want to introduce those folks briefly. We have Sibby Anderson-Tompkins, who's Special Advisor to the Chancellor and Provost for Equity and Inclusion, Suzanne Barber, Dean of the Graduate School, Alan Blattner, Executive Director of Carolina Housing, Lauren DeGrazia, Assistant Provost and University Registrar, Steve Farmer, Vice Provost for Enrollment and Undergraduate Admissions, Gordon Merklane, Associate Vice Chancellor for Real Estate Operations, Kim Pittman, Executive Director of Campus Health, Jonathan Pruitt, Vice Chancellor for Finance and Operations, Kara Simmons, Associate Vice Chancellor and Senior University Counsel, and Barbara Stevenson, Vice Provost for Global Affairs and Chief Global Officer.
So I'll go ahead and jump into our first question. So what that looks like is, what is the policy for if someone gets a positive test, and who will be notified and who will be required to self-isolate? And I'll go ahead and direct this over to Ken Pittman, if that's all right.
Yes, thank you so much, Reeves. Well, first of all, both Campus Health and our partner at UNC Hospital both have testing capabilities. We follow CDC recommendations relative to the testing of symptomatic individuals, asymptomatic individuals who may have come in close contact with someone who has tested positive, asymptomatic individuals who might be in a high risk population, much like Dr. Cohen said, someone with comorbidities or are immunocompromised, and then those students who may, by virtue of their activities, have difficulty in physically separating. Think varsity athletes. We provide testing for all of those. When a student tests positive, we are required to notify the Orange County Health Department of that result, and then we initiate a process with that student. We provide instruction on self-care. We determine the amount of time that the student needs to remain in isolation based upon an onset of symptoms, or in many instances, they'll be asymptomatic. We work with housing and the Dean of Students Office and dining to provide support based upon their individual circumstances. We initiate periodic medical screening to make sure that we are abreast of how they're doing, whether they have an onset of symptoms, and whether or not we can keep them well during that isolation period. And then we initiate close contact tracing. And that process involves us working with the student to determine who, by virtue of a CDC determined definition of close contact, we need to work with to put into a quarantine environment. And once we make that determination, we enter a process with those students to get them the support they need during a time that they're in a quarantine situation. We do, again, periodic medical monitoring and provide wraparound support services to them, so that we make sure that we're taking care of not only our students who have tested positive, our students who are close contacts, but also do all of those things from a public health standpoint to take care of our Carolina community.
Thank you. I'll be asking the next question. So this is for Provost Bob Lewin, as well as Dean Reichenberg and Abigail Panzer. Will remote learning be made an option for all students? And if so, how are we going to ensure that all of those accommodations are made?
Well, I'll start off. The main goal is to optimize our flexibility, and so as it was previously described, we have a number of different modes of education, and most all of our courses will be taught in a way that students can participate remotely. And so we very much want to start off under the premise that wherever possible, we will try to accommodate our students. And if they cannot, for whatever reason, attend class, that they will be able to remotely access that course. There may be some exceptions to that. There may be some laboratory or performing arts elements that might make it more difficult. And we will work very carefully and closely with those students to make sure that they can get that experience and that they can stay on track in some other form. But that is our goal. We're building this out as we speak. And the college and all of the schools across the campus are engineering their courses with maximum flexibility in mind. And I'll defer to Abigail if you want to, and Desiree.
You know, I would just say flexibility is the key word here, and that's why this was designed. These instructional modes were chosen and designed in these ways, and everyone is on board with the flexible nature of this situation that we're in.
So I'll be with the next question. So we've been talking about these undergraduate courses, and graduate students are often on the front lines of teaching those undergraduate courses, particularly these in-person recitation classes that Dean Panter described earlier. And accordingly, we're very concerned about greater exposure to COVID-19 as a result of being in those teaching settings. So a common question I'm hearing is, how will the university ensure safety in classroom settings? I'll turn that to Provost Bluen.
Yes, well, thank you, Ryan. And that's a really important question. And I think that's one that we feel that we owe not only our students, but also our faculty and our TAs and our RAs, to make sure that they are in the safest possible environment. As Dr. Cohen mentioned, the most important protection that we can employ are masks. And so masks will be required. And so we will be modifying all the language that we will be disseminating to our community by stating very clearly that masks must be worn in the classroom. And so we will also preserve an appropriate social distancing. The World Health Organization has a 1 meter social distancing recommendation. The CDC has a 2 meter recommendation. And we will be blending those depending upon the environment that the student and faculty member might be in. So social distancing, mask wearing, and making sure that we have hand sanitation available around the learning environment, so both individuals can take personal responsibility for washing their hands and also cleaning their desks.
And if I may, just a quick follow-up to that. We talked about the accommodation for students that don't feel comfortable returning to be students in person. If there are graduate teaching assistants who do have those underlying health complications that make them more vulnerable, or simply are not comfortable with the risk of exposure, even with these precautions, will there be a commitment by UNC to not require them to teach in person?
Yeah, so just to be clear, all individuals who have an underlying health condition, we will accommodate them. And so whether it be our faculty, our staff, our students, our graduate students, we would do everything that we can to make sure that they have the experience in the educational mode, and also if they are contributing to the education or contributing to the research, to ensure that they can do that remotely. All individuals who have other non-medical reasons, we are asking them to work through their supervisors, whether that be their mentors or whoever they report to, and then they would seek accommodation through that individual.
Absolutely. I could go ahead and ask the next one. So for students who do not return to campus for the fall due to being concerned about safety in regards to COVID, how does that impact their residency for tuition purposes if they continue their classes online? And does it impact the cost of tuition for being in-state versus out-of-state? I also want to make sure that there's a live poll everywhere question response form for those who are interested. But my question would probably be best directed at Provost Bluen or Vice Chancellor Pruitt.
Thank you, Reeves. I'm happy to address that question. The method of delivery, virtual versus on campus, has no impact on the residency of the student. So the student would be charged the same either way. So I hope that addresses the question.
Our next question is, how will the university be addressing off-campus social gatherings in private residences like the nearby apartments on Franklin Street? And this question is directed towards Jonathan Sauls.
Thanks, Pri, and that's a good follow-up to one of my early remarks about the importance of recognizing that we're not having a campus-only conversation. Fully 60% or more of our students live in our surrounding communities. And so it's just as important that we are thoughtful about how we are engaged with one another, not only those who are campus affiliates, but also our neighbors and community members. One of the first things we're doing is we're already engaged in an awful lot of conversation with some of our student groups, our Greek organizations. We're talking with, through our off-campus student services, a lot of our apartment complexes that we already partner with. to be able to share with them first and foremost what it is we're doing, share the benefit of some of the knowledge that we gain from our infectious disease experts and others. Many of them are already working on their own specific plans for how they will regulate common areas, pools, et cetera. But they all benefit from having some instincts from what we are doing. I also think it's going to be critically important because the important steps that we're going to take need to happen before those events occur. We can always respond after the fact or once we become aware of it, but we miss the ideal opportunity for us to be engaged, and that is for folks to certainly be able to find out how they can engage with one another socially, which is an important part of everyone's desire to come back, but to do so in a really responsible way. Large parties are going to be very difficult to anticipate happening in the near future. Most of them would not comply separate and apart from university regulations with state and local requirements. And so we strongly encourage all students and student organization leaders to be very thoughtful. If you have questions, reach out to us in Student Affairs. We'd be happy to help you think through even how you might transform that event. But even if you're going to do a small scale type of event, doing the things we've been talking about tonight, engaged in appropriate social distancing, making sure that masks are not just a suggestion, but a requirement for that event. The positive peer pressure that all of you and all of us can be able to bring to bear. I think that sometimes we can go down the rabbit hole of talking about this from a purely enforcement standpoint. There will have to be mechanisms to ensure that we are doing the things that are requirements. But the most effective way that we're going to get there is through a universal adaptation that we need to do things differently for the collective well-being of this community. And so I really hope that students will give that some thought. I know sometimes that we get overwhelmed by just our desire to get out of the places we've been sheltering these last several weeks. I feel that same pressure. I want to get out and go to my favorite restaurants and do the things I've always done. But I also stop and pause and think about the impact, not just on me, but on those that I care about, including all of you as students. And so what I really commend to all those who are listening tonight is to be part of that vanguard of individuals who will be able to share that it's not a choice between no activity and all activity. That sometimes becomes the false choice. It is how do we engage in responsible activities, mindful of the good guidance we've gotten tonight and will continue to share.
Thank you, Jonathan. Just as a follow-up to that question, you started touching upon that piece of enforcement. So I was wondering if you could elaborate a little bit more on how community standards like mask wearing and like social distancing will be enforced come the fall.
Yeah. So one of the first things we'll do is, as we are finishing up some of the details of making sure that folks can be really clear about what those expectations are, like all of our standards on campus, honor code with which we familiarize all students, expectations in the classroom. Those are all things that we do. We're at our best when we share it with folks up front. We're going to be very transparent about what those expectations and requirements are, and really work hard to engage in a affirmative, proactive, repetitive education process through active communication. My hope is that then we're going to have a de minimis number of cases where folks just find themselves not complying with the universal standard that's going to be applicable to all members of this community. But I might invite every student to think about it as this is sort of akin to one of the conditions that you have to meet in order to be a residential on-campus student. If you don't meet certain conditions, whether they be academic, financial, et cetera, then you're not permitted to be a member of that community. And so before we have to get into all the bells and whistles of exactly the process, an appropriate starting point is to think about if we're not going to meet the conditions to make sure that we're promoting a healthy and safe community, then the question has to be asked whether someone can remain a member of that community in the same way. So if, for example, a student is here in an in-person capacity, but they simply decline to wear a mask, then the question has to be raised of whether or not it's going to have to transition to a remote-only form of instruction. We can't elevate one person's individual preferences over the collective health and well-being of the community. So there will be enforcement expectations, but I'd much prefer that we collectively get there through recognizing pedagogically that this is just a sound and smart and healthy thing to do. But we are prepared to meet those challenges in those hopefully very rare cases where we have to address them.
So my next question, I'm going to direct this at Dean Barber. Will graduate students whose research has been interrupted by the pandemic, either by being unable to access labs or the library or conduct field research, be granted extended time and additional funding to complete those degrees?
So thank you for that question. In terms of extended time, we already have a process in the graduate school for students to request an extension of time to degree. And so we'll continue to entertain those requests on an ad hoc basis. In terms of funding, that's an important question that actually is not centrally located in the graduate school. Most students' funding actually comes from other units around campus. And so it will be important for students to have conversations with their advisors, with the folks who are supervising their RAs or TA-ships to find out about funding issues. I can tell you that the federal funding agencies are aware of the challenges associated with COVID-19 and the delays in students being able to finish their research. And they're already thinking about strategies to ensure that grants can be extended, that there can be supplements to grants, so that there can be continued support for students. So again, that's something that students need to address on the local level with the folks who are actually responsible for getting them paid.
Yeah, absolutely. And I'll follow up with another question. What concrete steps is the university taking in order to make campus a safer, more equitable, and just place for students of color, especially Black students? And I'll direct this at Sylvia Anderson-Tompkins.
Thank you, Reeves. You know, with recent national events and local organized gatherings and protests, it's obvious that there's a real need for action. And we've heard from our students. In the past, we've had community sessions, Build Our Community sessions, the Commission on Safety. In terms of safety, I will say, and I think our chancellor spoke to this earlier, David Perry, our chief of police, has worked to ensure that there's a different philosophy taken in terms of policing, using community policing. He's come in looking at policies and ensuring that his officers go through regular training. So I think that there's an effort on the part of our campus police to revisit how we police and to ensure our students are safe on campus. But in terms of equity, structural racism, we have a long way to go. And we are starting to take those steps. So some of the concrete steps that we are taking involve making sure that there is a space on campus where students feel safe. We're having community engagement so that there are places where students can find support, mental health resources. And we are also taking very active steps to ensure that we look at policies and practices that hinder access and opportunities for our students. We want all students to thrive. We want all students to feel like they belong and that they're a significant part, an important part of this community. So we are working with student leaders closely to make sure that they are heard, they get opportunity to have feedback, and are an important part of what is the start of a real planning process for a diversity, equity, and inclusion strategy on this campus.
Thank you, Sibi, for sharing all of those next steps. Our next question is from Poll Everywhere. The question is, we've seen a record number of COVID-19 cases in North Carolina in the past 5 days. Are we considering hitting the pause button from asking students to return to campus in 2 months until things in North Carolina improve? And if not, what do the off-ramps look like come the fall? This question is for Mike Cohen as well as Chancellor Guskiewicz.
Thanks. The problem is anything we see is delayed and dynamic. So it's when we look at hospitalizations, that's a metric, but it's a very imperfect metric. When we look at new diagnoses, it's a metric, but an imperfect metric. I think we're trying to monitor this very carefully and determine whether it should have an immediate or other effect on these decisions that have been made already. Of course, as Chancellor Guskiewicz made these decisions, he couldn't predict today and yesterday the number of cases in the hospital. What's interesting to me is one day the press will report 730 people in the hospital, the next day 700, as if it's a major improvement. That's not really how this works. It's an ongoing dynamic process. And the decision of why someone stays in the hospital, how quickly they go home, is another dynamic process. I'll tell you, when we first started this, people stayed in the hospital a very long period of time. Now, and Dr. Fisher can address this, people stay in a very short period of time. So it's a process that we have to attend to very carefully. This is what, June 11th. We'll watch it every day. And Chancellor Guskiewicz can respond better than I.
Sure. No, thank you, Dr. Cohen. We certainly are continuing to monitor the situation across North Carolina. We have stayed in close contact with Dr. Erica Pettigrew, who is the head of Chief Medical Officer for Orange County Health Department. And we're looking at where these hotspots are across North Carolina. Fortunately, Orange County, which obviously is where UNC Chapel Hill is located, while we have seen an uptick, it's not nearly as bad as it is in some other parts of the state. But again, we're still eight and a half weeks away from the start of that semester. But we'll continue to lean on our experts. We've got the best in the country, the best in the world, in my opinion, to help us make these decisions. But we'll be prepared for those off ramps as we monitor the data across the state, and especially here locally.
So I'll be taking the next question, and I think this is something that is on the minds of just about every person on this campus, including students, which is access to campus. The vast majority of our students, both undergraduate and graduate professional, live off campus. And I was hoping that we could hear more about how campus access will be managed in terms of the bus system, parking availability, and things of that nature.
Jonathan, I thought Gordon was going to take that question, but I'll take that. We are currently evaluating parking capacity on campus as we're bringing research back into on-campus operations. We know that demand for parking is likely to be higher in the fall as more students return to on-campus experience. We've also been working closely with our local Chapel Hill transit partners and regional transit partners to understand the capacity and the frequency of bus routes and understand what the social distancing requirements might be for the bus system. So we're capturing a lot of data. We do anticipate more frequent bus routes to campus, although at reduced capacity in the near term.
Thank you for that, Vice Chancellor Pruitt. I'll like to follow up with another question on how does the university plan to address burnout for students and instructors alike with a shortened academic calendar, shortened exam period, and with no fall break either? And I'd like to direct this to Dean Rickenberg.
Sure, I'd be glad to talk a little bit about this, and then also invite Ken Pittman to follow up if he has other comments specific to holistic health. I think this is one of the things that we have brought up several times, and recognizing that that our students have done so much, and really our campus has done so much to make it through the spring transition. Many folks are engaged in summer learning and then just trying to figure out how to start the fall semester. And so I think our CAPS, Counseling and Psychological Services specifically for students, is really looking at opportunities to be able to continue to enhance the services that they're providing, and also be able to meet the current needs and what we anticipate are ongoing needs. And so we know that there are significant impacts to our students related to COVID. We also know that there are significant impacts to our Black and African American students related to systemic racism and oppression, and so CAPS has really stepped up to be able to not only serve and support those folks now, but also has demonstrated a commitment to being able to do this work as we move forward. in student affairs, as well as some of our partners across campus who work with students, we have established a health and wellness leadership team who's really taking a critical eye and examining opportunities to be able to deploy effective strategies to recognize how students are being impacted and what we need to be able to do. So I think that you can look forward to hearing some more information about what those strategies are going to be, and also opportunities for you to engage in helping to develop some of those. And from an employee standpoint, I'm not the expert in employment spaces, but I do know that as someone who supervises staff and has been able to work with many of our HR partners, that we're still looking and continuing to provide support, and would really encourage folks to reach out to their HR liaisons, EAP for specialized service and support, and know that the university wants to be able to do all we can to serve and support folks. Ken, did you have anything else you wanted to add?
Sure, I agree obviously with everything that you said, Dean Reichenberg, as I always do. And I would just add that in the counseling and psychological services space, that area has really pivoted toward telepsychiatry. They're doing medication management and brief therapy. It's very important in this space that we support not only our students who make a decision to return to campus, but those who are engaging in remote instruction. And so telehealth and telepsychiatry is an important part of our offering. It's very important for everyone to know that we continue to have CAPS 24/7, which is the ability for any student to talk to a mental health professional 24 hours a day, 7 days a week. And also there have been a significant number of initiatives just during the last few weeks that have been developed around expanded support groups for those that are experiencing anxiety, depression, other indications from both COVID-19 and the racial stress and issues that are going on in our country. And finally, CAPS is expanding its staff with a few more therapists that are specifically have expertise in the area of serving persons of color. So I think we're making a huge effort, not only to deal with the burnout issues, Reeves, that you mentioned, but also with the issues that our students will be facing in a very uncertain and evolving environment.
Thank you. The next question is regarding the quarantine dorms on campus. So what would be the criteria for being moved into one of the quarantine dorms? It seems like every one person with COVID could potentially come in contact with many people before they know they have it, leading to many people who may be isolated, but keeping in mind we only have 2 dorms on campus that are specifically designated for quarantine. And this question is directed to Jonathan Sauls or Ken Pittman.
Yeah, I'm going to start quickly, but I think it's going to reference back to some of the things that Kim was talking about earlier in terms of some of the indicia and criteria we would use for identifying who is a close contact and therefore might meet criteria for either quarantine or for those students who test positive for an isolation space. We have made a determination to take 2 residence halls offline, will not be subject to regular assignments for residents, so that we'll have them available as needed for individuals who are living on campus who need an assignment for a temporary period of time for quarantine or for isolation. And Ken, maybe you could speak just a little bit about, again, some of those criteria we'll use to identify who would utilize those spaces.
Sure. One of the, and I'll also reference my colleague in housing who will have some additional comments. We will have the residence hall that will be dedicated to students who have tested positive. It will be available to students who may not have any other resource other than being in that particular space. There will be some students who have an off-campus housing situation once they test positive, who that housing situation will allow them to isolate in place. So it may be that they do not require the living on campus, but they will still have access to all of the services that I described before relative to medical monitoring and campus outreach kinds of services. any student who is identified as a close contact of a positive student, or any student who is undergoing testing and do not yet have a positive result, will have access to the quarantine facility, and again, with all of the outreach services that we'll be providing. Alan Blattner may have some additional comments regarding the specific services in the space that we've identified.
Sure, thanks, Ken. And first I want to say thank you to our students who were assigned to the 2 buildings that we needed to vacate in order to stand them up for this use. I know that was not ideal for you. It was not ideal for us to have to ask, but I appreciate everybody's patience in working with us to make this critical service available. We will be providing meal delivery to the students who will be staying there. We will be putting microwaves and refrigerators in each one of those rooms so that they can be more easily a self-contained unit where someone could be as comfortable as possible. We'll be working with our Dean of Students partners to reach out for academic connections, as well as leaning on campus health to continue to do the medical monitoring that's necessary. One of the things I also wanted to say in terms of the capacity of those spaces, one of the things we learned in our very short time in the spring was that many of you will choose to go home if you are in need of quarantine or isolation. And so that will continue to, of course, be an option. And then this will become the supplemental housing for those of you who either cannot go home or who might need housing for a particular few days until you make arrangements to go home. And so we're hoping with all of that coming together that these resources will serve our community well.
I'd like to direct the next question to Provost Bluen. So as we know, many students are not just concerned about their own well-being in light of all this, but also of those whom they take care of. So many of our graduate and professional and even our non-traditional undergraduates may have children or spouses. There may be folks taking care of family members in their home setting, and are therefore concerned about what returning to campus means from them. And so my question is, how will the university be accommodating and supporting those individuals, especially those with children, if the public schools remain closed in the fall?
Well, thank you very much for that question. And I think the answer to the question not only applies to students, but also to our faculty and to our staff. We know that there are many extenuating circumstances that will require that individuals stay at home. And we will need to make appropriate accommodations to enable them to continue to do their work wherever possible from a remote location. And so the direct answer to your question is that absolutely, we will accommodate individuals who have extenuating circumstances that require them to be at home. We believe that that's a very important. Individuals will have a whole host of reasons why it will be important for them, a spouse, a child, a parent, with either a medical condition or the need for childcare. And so this is why we're trying to make sure that so many of our learning and teaching environments are adapted for multiple flexibility to address many of the pedagogical modes of delivery. So whether you're the teacher or the learner, we want to make sure that you have that option to both teach and learn from a distance. Now, there may be some specific situations where that might be difficult, and that's where additional accommodations will have to be made.
Thank you for that question, Provost Bluen. I would like to ask another question, potentially our last question. So will Carolina Away be available for non-international students who are immunocompromised or otherwise unable to medically come to campus comfortably? And this will be directed at Steve Farmer.
Great question. Thank you. As you've heard Provost Bluen say, we really want to be as flexible as we can. And as you've heard Dean Rickenberg, Vice Chancellor Sauls, Dean Panter say, we really want to do our best to meet the needs of every student. So Yes, Carolina Way will be available for students who can't come to campus, for students who prefer not to come to campus for the fall. We want Carolina Way to be a first-rate experience for everyone who needs to be elsewhere, regardless of the reason.
And I think that sums up the question and answer forum. Oh, actually, I think there might be one more question that we could ask. If I'll hand over to Pri.
Yep. So our last question for tonight is another question from Poll Everywhere. It's for Dean Panter. When will students know what type of teaching methods will be implemented for their specific classes so they can begin planning for the fall?
We're working on this now, and the registrar is working on making sure that it's very clear what mode will be associated with which course and which section. So as soon as we have that, this is every department and every school is going through this process at this time. And once we have that, I'm not sure the exact date, but we're going to be very clear up front, and every syllabus for each class will also be very clear about what the expectations are.
And if I may, just as a follow-up, and I don't know if this will be for Dean Panter or for Dean Barber, but is that same timeline estimated for the graduate and professional schools as well?
Yes, same timeline. And I'm speaking to graduate programs that are managed by the graduate school. The professional schools that have programs that aren't managed by the graduate school, they have slightly different schedules. And so it's important for students to talk to their program administrators in those schools.
One last question. This is directed towards, I think, Gordon. And Jonathan Pruitt. Will dining halls be serving students who still do not live on campus? I know that dining halls will be open to students, residential students who have bought meal plans, but wanted to inquire about off-campus students as well.
This is Gordon Markline. We're going to start the semester off offering limiting meal plans to just residents on campus. We think this is necessary as returning students will know that Lenore and Chase dining halls are already very full. And in order to implement physical distancing of keeping tables 6 feet apart, as well as limiting tables to one individual, we have to try to reduce some of the numbers. To counter that, we are increasing the food options. We're going to be bringing food trucks to campus. We're going to be expanding the food options at the other Carolina dining service options, numerous places around campus. And we're also going to be expanding app-based dining orders and pickup orders for meals that will be available to all students, all faculty, and all staff.
Absolutely. Well, thank you so much for that. And I wanted to thank everybody for submitting questions, and I'll now turn it over to Chancellor Guskiewicz for concluding remarks.
Great, thank you, Reeves. And I also want to just thank everyone for joining us this evening. And we certainly know that you thrive best here on campus with access to the co-curricular and extracurricular activities, and where you can enjoy the types of interactions that complement your in-class learning experience. And we know that you also want to be in an environment where you can safely interact with each other and have the benefit of the day-to-day interactions with our world-class faculty here at Carolina. I say it often, but Carolina is our people, and most importantly, you, our students, and we want to be together here with you on campus. I think you've seen this evening that a lot of work is going into trying to make this possible. And even though it's going to look and feel very different, we believe that we can get you here safely on campus, but it's going to take a lot of work and a commitment on your part. And I think you heard from our infectious disease experts tonight that what that commitment can result in. And so we are just about 8.5 weeks away from the start of the fall semester. And I hope that you will return to campus prepared to adopt our community standards, which are still evolving. I want to thank our panelists who have been working tirelessly to help develop our roadmap for the fall 2020 semester and to create a safe learning environment, a safe research environment, a safe teaching environment, and a safe campus where others can visit. And so we are committed to this at Carolina, and I hope you'll continue to follow the roadmap for fall 2020 website, which is carolinatogether.unc.edu. And we'll be updating it regularly, and look forward to hearing questions from you as you may have them as they evolve. So again, thank you, go Heels, and good night.